Welcome to Aim in Practice. I'm your host, Jess Reynolds, and on this podcast, we explore the world of integrative and complementary medicine and its application in real-world clinical practice. Now, each episode, we dive deep into conversation with practitioners, authors, thought leaders, and innovators who are shaping the future of holistic healthcare. Now, today I am chatting with Ryan Staal, a manual osteopathic therapist, strength and conditioning specialist, one who works with special populations, and an educational facilitator. Now, Ryan brings a very unique perspective to the world of osteopathy, blending his background in fitness and personal training with the very gentle, holistic approach of osteopathic medicine. So in today's episode, you will learn how Ryan's journey from personal training to osteopathy shaped his approach to healing, the principles of osteopathy and how they differ from other manual therapies, the importance of fascia in osteopathic treatment and overall health, how osteopathy addresses the mind-body-spirit connection and healing, and the role of gentle techniques in creating profound changes in the body, and much more. So let's dive into our conversation with Ryan and explore the fascinating world of osteopathy, its holistic approach to health, and how it can be a very complementary form of wellness and health. Today's episode is sponsored by Jane, a clinic management software and EMR. Now, the Jane team knows that when your workday is spent providing care to your patients and clients, it can feel like there aren't enough hours in the day for all the rest of your admin tasks. This can mean that scheduling appointments becomes an after-hours task, turning what should be a restful evening into extra long workdays. That's why Jane has designed a user-friendly online booking system so you can give your patients the freedom to book their appointments at their own convenience, whether that's after hours or on weekends. Patients can also manage their appointments, fill out intake forms, and even enable SMS and email reminders from their secure online portal, which saves you from having to manually do all this work. So to see how Jane can help you reclaim your evenings and weekends, click the link in the show notes to book a personalized demo, or if you're ready to get started, you can use the code AIM1MO at the time of sign up for a 1-month grace period on your new Jane account. Well, Ryan, thanks for taking the time to chat with me. I'm really looking forward to this chat because, of course, your personal trainer, osteopath combo, I find these two areas absolutely fascinating. So I'm super excited to really pick your brain and learn a lot more about what you do. But I'd love to start with your story. What got you into this whole industry in the first place?
Yeah, starting from a very young age. Like my dad was a huge influence. He's a big fitness guy. I have lots of vivid memories of growing up working out with him. He would go on a run, and then me and my siblings would be riding our bikes trying to catch up with him. So just kind of like all the fun things was kind of associated with like exercise. And then that kind of just bled into, playing sports. And then started really enjoying sports because I was, fit, and then also playing sports, so excelled in sports. And then, went through a couple of injuries and appreciated the recovery process from injuries. Like my first experience with a physiotherapist was kind of hilarious, actually, because I honestly had no expectations of what they were going to do. But essentially, it was like torture for about half an hour, where literally it was like them mobilizing my broken ankle, and it was just like I was biting into the pillow, and so I was like, oh, like it was not necessarily pleasant, but it was very helpful. Like I was able to recover, get back to playing sports very quickly, so I was very appreciative of it. But yeah, that was kind of like what my thought of what physiotherapy was. But then later on, I started having had more injuries and realizing, okay, it's not actually all just torture. They're, actually trying to help you recover, giving you exercises. That was their means of, rehab. So I was like, oh, this is really cool. I really appreciate what they did for me. It motivated me back into, playing sports again, because it can be pretty traumatic sometimes having an injury when you're like training really hard. And I know for me, like I was trying to make it into, hockey was like my main sport. And so I played some higher level camps that, I wanted to make it big. And yeah, when you get an injury, it's kind of like that mental part of like, oh, like I put all this effort in. So just for that mental support too from the therapist was very appreciative. So that's kind of what got me into the field, was like I really loved what they were doing for me, and also just like how exercise made me felt. So I utilized exercise as a way to help people feel better. So that was kind of like what got me into osteo was like I was a trainer. I went to university, wanted to just learn more about the body and how we can help people. Um, and then, yeah, eventually, osteopathy kind of fell into my lap. I was training people, and an osteo came to my gym, and you know, I remember him bringing his little pamphlet trying to explain what it was, and I still had no idea what it was even after reading everything. And I feel like that's still kind of fairly common.
Hmm.
But just the concepts he was explaining about how everything's connected, lifestyle, all those things, it was like very in line with what I believed. So that's kind of like what kind of dropped it into my lane of where I want to go. And
Hmm.
yeah, and then eventually I heard about the program. It kind of was like around COVID time too, actually, where it was like, gyms were all closing, and like I was like, oh man, like I feel like I almost need something to make sure I can still work. And so that's where I found this osteopathy program. And actually that was like kind of weird timing because yeah, while everyone was kind of like isolated, that's when I was really studying osteopathy. So it was cool. I was able to kind of have that extra time where we weren't socializing. I could just like study the body. So yeah, that's kind of in short how I got into osteopathy was kind of like through fitness.
That's cool. That's cool. I mean, there's a lot of threads I would love to pull in that story.
Sure.
I want to really dig into what osteopathy is, but I really appreciated about what you said with the sort of mental aspect of recovering from an injury. And I mean, I've been there. Many people have been there, and I think that's something that's unfortunately in most of the manual therapies out there, which in my opinion includes things like chiro and physio and um, certainly massage and perhaps osteo. I'd love to know more about how much this is included. But
Mhm.
the mental aspect of recovery is just barely touched upon. But my experience personally in dealing with clients is like the physical recovery, it's just going to happen. It doesn't take much facilitation as the practitioner to steer that in the appropriate direction so the tissue heals properly, right? It's
Mhm.
relatively simple. But the mental game of suddenly, like you're an athlete and you're looking at, am I going to play hockey again? Or is this going to stop me from running? Like, gosh, the mental game is huge.
Mhm. Yeah, absolutely. Yeah, it's like your identity almost becomes like it's like, oh, like I'm not this person anymore, so who am I now? But
Yeah.
yeah, I think yeah, exactly. That mental aspect is yeah really not touched on at all. But I think it can be a part of it, and some people almost indirectly do it just through their personality, through being empathetic and that sort of thing. But yeah, definitely not something that's really thought of as much in terms of yeah how it can affect people's recovery. Um,
Hmm.
yeah, no. So that's that, and that yeah is part of yeah. We'll kind of touch on that in osteopathy, how that's a part of how we, get people feeling better too. Is that in enforcing that you're not broken. You have this endless ability of regrowth and
Hmm.
healing. So it's you're not your injury, you're not your pain. You are
Right.
something that can overcome those things. So yeah, just having someone just say
That's amazing.
that. Yeah, exactly.
Yeah.
Right, just like saying that it's possible, right? It's possible for
Hmm.
you to get better. Like having someone just to say that, because yeah, sometimes there's that belief of no, I'm never get better, or I'm always going to be like this. I feel like that's unfortunately something that I hear common, where it's like I feel like I'm stuck like this always, and
Yeah.
yeah, so and that can be a hard thing come sometimes to break. Um,
Yeah. Yeah.
so
I
yeah,
totally agree. And I'm curious about if you could explain osteopathy like
yeah,
in a sentence.
one sentence. Yeah,
I want to like expand it, but the reason I'm curious about this is I find it so sort of ephemeral. Like my understanding of osteopathy is mediocre at best, right?
okay,
Because it seems to be something that's quite hard to explain. So do your best to see if you can explain it like in brief, and then let's like really dig into what it is and what it can do and all that type of stuff.
yeah. It's actually funny with when people ask you kind of like that elevator pitch of what
Yeah.
osteopathy is, and it's funny because it's something that they get us to do in school, where it's like, okay, you need to define it in 50 words or less. And I remember when I had this assignment, I literally wrote it out like probably 20, 30 times just because I was like, not happy with this, not happy with this, feels too wordy. And yeah, there's a lot of kind of big concepts to explain. So yeah, definitely to I'll do my best here to try to put it in just like one fairly broad sentence here, is that it is like a holistic therapy that utilizes the anatomy to facilitate healing in the body, just to keep it
Okay.
pretty plain and simple. Um, and obviously, yeah. But again, it's kind of like using, when you hear that, it's like, okay, but how?
Mm-hmm.
um,
Yeah.
and I think that's where I dive into a little more about the principles of osteopathy, because I think osteopathy is not really a thing that you do, it's kind of like a thing that you believe. So again, kind of like you talked about how the body heals itself, right? That's our main belief, right? Is that you get a cut, right? It's going to heal on its own, right? But there's going to be factors that either speed that healing or can hinder that healing, right? I've actually experienced this myself where, playing hockey, right? Get a cut or injury, and then maybe that later that night, you're drinking with the buddies or something like that, right? And I've noticed where, after a night of drinking, that scar or whatever doesn't heal very well after a night of drinking. So, and that's just an example, right? There could be other things like you lack of sleep, bad nutrition, right? Maybe you just like don't drink any water at all, or you just drink pop all the time. So it's just all those like lifestyle things that all kind of play into it. But yeah, essentially, yeah, like there's so many factors that can impede or hinder, which can be seen as kind of a scary thing. But I look at it as like a thing where it's like we have so many opportunities for us to improve our health, right?
Mm-hmm.
Um, so yeah, so we have this unlimited capacity of self healing, and I think that self healing process, a lot of that in terms of like osteopathy, is the structure equals kind of function, and this is not just from a specific posture kind of standpoint. This goes from everything from the big structures down to the actual cell structure. So yeah, and so when things are generally in their ideal structure, things tend to function really well. Um,
Okay.
but
Let's
all
talk
the
about that. Let's talk about ideal structure.
Yeah,
So how does osteo help somebody move back to ideal structure? Let's actually define ideal structure first,
sure,
and
yeah.
then move into how does an osteo help a client move into this?
Yeah, yeah. So like every single, I guess, structure, it's made in a way to perform a certain function, right? So like if you have like, yeah, like I would say, I like using the spine as an example, because the spine has that kind of like S curve, right? It's used to kind of absorb force, right? So if you have a spine that starts to become more straight, right, it's just not going to be able to absorb that much force, right? So I guess the cause of why that spine is becoming straighter is numerous. There could be tons of reasons why a spine might start to straighten out. And that's where we start just diving in. Okay, like all the lifestyle things, right? Do we have tons of stress? Are we doing lots of things for our health? So it becomes like you start diving into a bit of a rabbit hole in terms of like, what is it? But I think from my standpoint, I'm looking at central structures. I'm looking at kind of like the main things from the center, seeing how they're kind of positioned. Because I think those ones really dictate how the periphery, in terms of the shoulders, elbows, knees, how those kind of sit. So that's generally kind of like my approach, is like we can adjust central structures so that they are, in that nice anatomical position. And I
Mm-hmm.
think there are people that just their body adapts to what they do, right? You have a boxer, they're going to start becoming more adapted to boxing. And I
Mm-hmm.
guess, yeah, is that ideal for just day to day living? Maybe, maybe not. But if their goal is to be the best boxer in the world and they don't care about anything else, then that's kind of what is their function, is that structure.
Okay.
So that's where it is a little bit. It's a little fluid, right? It's a really kind
Mm-hmm.
of like, if we're talking just like, okay, I want to just be functional day to day. We kind of think about just like the general normal positioning for just everyday function. But yeah, that's where you get into like more of like performance based kind of things. I think then you kind of have a little bit of change in terms of what that looks like a bit. But uh, but yeah, I think ideally you still have balance. You still have the ability to get back into a good position. You're not like always stuck. And I
Mm-hmm.
think when I think about a body that has really good structure, it has a lot of play. Like it can move in all different directions. I think about gymnasts as really good examples, right? They have so much flexibility, but they're not just like loosey goosey. They actually have lots of strength and stability there too. And that's what I think is what true mobility is having range, but having control in that range.
Right. Yeah, the combination of flexibility and stability.
Yep. And I
Yeah.
think that's kind of what gives me a little bit of advantage as well as having that strength conditioning background is that I recognize when there's times where there's, you know, there's tight muscles and there's weak muscles. And sometimes they are
Mhm.
kind of sometimes one and the same, but not always. But definitely just even from my history of like helping people through fitness, um, you can make so much good change by just having some good technique and form for your exercises. Um,
Mhm.
but again, when it comes to going into an osteopathic session, not always the topic of conversation. And even though I like talking about that, that's not their purpose for necessarily being there. But again, I
Right.
do want to be a good ambassador for health and wellness and fitness because I do believe that exercise is really one of the best forms of self care. And in terms of holistic side of things, I think it's one of the best things you could do. If we
Hmm.
want to talk about fitting into the holistic realm of things too.
Hmm. Yeah.
But
As I was hearing you describe things, what came to me is this discussion of ideal structure. The example you gave of the spine makes complete sense. Uh, and talking about the physical structures, joints largely within that conversation. But I'm curious, within the scope of osteopathy, is that what you or osteopaths in general focus on? Is the anatomical structure, making sure that the joints are doing what they should do, or is there other lenses in which an osteo looks through?
100%. Yeah, lots of different lenses. I think because you can look at the structure or you can look at the function. You can look at, you know, are they functioning well? Are there movement patterns within certain organs that are moving well? So we can look at it from both ways. We can look at it from like a structural standpoint, or we can look at it from a functional standpoint. And I think um, as you learn as an osteo, you can kind of get pulled into like, oh, I'm more of a functional osteo or more of a structural osteo. And for myself, I do try not to be one or the other. I do try to do both, so I'm not biasing my treatments. Um,
Hmm.
but yeah, definitely, I think in terms of like other aspects, like it wouldn't be just the bones because we know that they kind of influence each other. So that's where there's lots of people I've like they have back pain or neck pain, and then I'll look through the spine. And it's like okay, there might be a couple little things, but it's not like okay you're like completely sideways. So it's like
Hmm.
in this regard for the spine, even though you have pain in the spine, right? There's not really any structural stuff I'm seeing, right? So it becomes more of like, all right, there's functional things that are happening here that are probably more influencing what's going on here.
Right, right. What's it like going for an osteo session? Because I was thinking about what you were saying about your first physio experience. Just biting the pillow with pain, and the effect was good, but the process itself was painful. Is that something that osteos do as well? It's just like we cause pain, or is it more of a gentle, relaxed, or somewhere in between? What's it like?
I so honestly, I would say it's like pure treatment, as in like if you're expecting to say, hey, I'm going to give you a treat, right? You're
Mhm.
expecting something that's really nice. And that's what I think osteopathy. It's really nice, really enjoyable, really gentle. Definitely this is case by case because there's going to be some times where you're coming in with lots of pain, right? And there's going to be times where it's like we might not be able to relieve any pain right in that exact moment. It might take a little while. But I would say for the most part, our main goal is to make sure that you're staying out of pain as much as possible. Um, Osteopathy is considered an art form where we can adjust our techniques, their positioning, our positioning, to however we need to in order to accomplish that. Not stimulating any pain in the person. So that's kind of like our whole goal. Right? And I always say that sometimes if I'm feeling things, right, I'm kind of feeling a certain area. I don't know how sensitive you're going to be, so I try to keep my touch always as gentle and soft as I can, but no matter how soft you are, sometimes things are still going to be sensitive. So, but that's where I'm not like really grabbing on because that would, I think, definitely give that person a little more of that stimulus. But yeah, we're just very gentle, and I think that kind of goes with how we affect cell structures too is our touch has to be super soft because that's how we try to create fluidity within the cells. It's that stimulation of soft touch. So yeah, I would say when people go to see it, it can vary. Like people will fall asleep on my table, which I think it's awesome because it's like they really just need relaxation,
Hmm.
not expected. And I don't necessarily tell people, oh yeah, you're gonna fall asleep or anything like that. But I just kind of say if you do tend to doze off, it's okay. Like I can still do all the things that I need to do. Um,
Yeah.
but yeah, every single treatment I've ever received has been. I look forward to osteo. Um, Unfortunately, like yeah, like I love massage. I love all forms of self treatment, but in terms of ones that I just feel the most relaxed after, I would say osteopathy. Um, yeah, like and I just like I have tight muscles, so like whenever I get a massage done, like I know there's certain spots that are just like I'm kind of gripping a little bit, and
Hmm.
I know maybe to some degree that's good, but yeah, for just if you want to just feel completely relaxed and zen and uh, yeah, I feel like that's where osteopathy comes in. It's just so relaxing.
I've had this hip problem. It's just started just spontaneously out of nowhere last October, and I mean I'm in this world, right? Like I do I should be able to figure out what's going on with my hip. So I couldn't. I go, you name the modality, I tried. Like I seriously went through the checklist of everything I could possibly come up with.
Hmm.
It was months and months of treatment and the amount of money I sunk into it, and it was locked. Like almost no movement and 9 out of 10 pain.
Oh dear.
And I started to get a bit of freedom, bit more mobility back in there, just gradually, because time does a lot of good for these types of things.
Yeah.
But not too long ago, I went to a session, and it was sort of I'd just say a body worker in general, somebody with like a bunch of different tools.
Mm-hmm.
And she grabbed my leg. I was lying on my side, grabbed my leg, and so gently, and this was a osteo technique,
Oh, okay.
so gently moved my hip through range of motion, and it was like snail pace, bringing it into flexion and slowly bringing it into extension. And there was this one spot that she just felt and held it there. That was it.
Yeah.
Just held it in this stuck spot. And my feeling wasn't pain. There was no pain, but there was definitely a sensation of like, huh? What's that? There's
Hmm.
something there. Like my body was not bracing but prepared. And she
Yeah.
just held it. It was so gentle. And then she let it go gently. And sure enough, my range of motion was like almost 100% after that. It was unbelievable. And I valued that gentleness and that listening, because from my understanding, osteopaths really learn to listen to their clients' bodies.
Yes, that is like a huge skill. Absolutely. Like I recall actually very vividly going into school and with my background as a personal trainer, because a lot of people who go into the program are usually have a background in massage or physio or chiro, some sort of hands-on therapy. And so I remember my facilitator was like, "You're gonna struggle. This is gonna be something that's gonna be hard for you because you just don't have that practice." And I took that challenge to heart. I was like, "Okay, let's get our hands on people. Let's start getting on different bodies. Let's really start to feel. Let's start to challenge my touch." And yeah, definitely, it's your main tool is your hands. And so I think it's just an ongoing skill because I still look at some of the some osteos and like the way they can just like they just go they just feel and I'm not quite to that stage where I'm just like just naturally there. It's still a little bit of that intuition really kind of listening in, but I can just see yeah, some people just have that sense where it's just like they just go right to it. So it's quite amazing how something that you can really refine. And definitely it's a huge part of our practice in terms of like finding out what's going on. It's sometimes to the point where you trust your touch more than you trust what the person's telling you is going on. They're like saying,
Mhm.
"Oh, like everything's up here. It's right here in my shoulder. Like all the problems, all the pain, right here." But then when you start listening to their body, it's like, "Okay, well, why am I getting pulled over to your hip here then, or why am I getting pulled over to your knee or wherever here?" Right? It's like there's this intelligence within the body that your body has that record of all the things that's happened to it, but your mind not maybe remember all those things. And it's actually happened a lot in sessions where I'm working with someone and they kind of they're I've asked them their history of like, oh, have you had injuries, this and that, and then we're already kind of going in through assessments and treatment. And they're like, oh, actually, yeah, I forgot that I broke my leg 2 years ago. I was like, yeah,
Hmm.
that would make sense with what we're feeling maybe here. So yeah, it's kind of fine where it's like there's times where you trust your hands a lot in terms of what you feel, and I think that's the part of the skill is that trust. Is like there's sometimes where I was like, why am I? You kind of like question it. You're like, well, why am I getting pulled over here? Doesn't really make sense. Um, but yeah, you just have to trust your intuition on what the body is telling you it's going on. So it's having that trust.
Has has that been something that you've had through your whole life? Like, have you been a fairly intuitive person and really in touch with that? Or was that something that once you started getting into osteo and body work that, light bulb turned on? Like, what was that process like for you to learn to trust your own intuition? And a follow-up question to that is,
Yeah.
how do you know? Like, what sensation, what voice, what idea pulls you towards something?
Yeah, wow, that's a good question. Yeah, I feel like actually it's funny because like I feel like my fine motor skills were never super great. I remember growing up trying to do sewing and knitting and having the hardest time trying to do all those little things. So definitely that was a skill that I had to really work on developing. And actually, funny enough, one of the things that I did was I used a food scale, and I used my food scale to kind of soften my pressure because there's certain techniques in osteopathy where we're only using 5 grams of pressure. And so you realize how hard you're pushing when you have a food scale. And I was like, when I was practicing, I was like, oh, I'm using like 50 or 100 grams of pressure, not 5. And then so you realize how soft you can be and how that soft touch can start changing things. Because your body is very resilient. It kind of understands if you're trying to force something, it's not going to let you do it. But if you're trying to work with it, um, yeah, it's a lot more receptive to that type of change. That's something I've just noticed day in day, and it's one of those things where I still blows my mind because you think 5 grams of pressure, like what's that going to do? But I'm proven time and time again how effective those types of treatments are, where less is more, which
Hmm.
from a personal trainer standpoint feels very backwards. Where you're like, okay, yeah, I got overload, push the weights, but it's very different when you're trying to provide treatment.
Oh,
So
that's such a cool balance. That's such a cool balance for you to hold this one modality personal training, which is very much like optimized when you do overload, progressive overload,
yeah,
followed by this other modality, which is optimized by minimum effective dose. Like what's
yes,
the
yes.
least amount of effort I can put into this and still get an effect. Wow, that's really cool. That's really
Yeah,
cool.
it is
Yeah.
really like yeah that balance of like yeah you just we gotta still work your body to make it resilient, but also be gentle and yeah just knowing how to just give yourself that self care and love. Yeah,
Mhm.
it's a
So
good
we've
balance.
talked a fair bit about what osteo is, but I'm
Mhm.
curious now about the misconceptions because defining it can be somewhat difficult. But I
Yeah.
think a lot of people have an idea, or maybe a lack of idea, or misconceptions, misunderstandings about what osteo is. So, what are some of the most common misconceptions that you come across in the world of osteo?
Yeah, I think the most common one, other than like people think it's like we just treat bones, um, I think the other one is that we're kind of like that blend of massage, physio, chiro, which I have done that in the past where I've said is that just because I know people know what those things are. But I don't usually like to say, oh, it's like this because I don't know. I'm not a chiro, I'm not an osteo, or I'm not physio. So I can't really speak on exactly what they do. I can only say from my experience. Um, but yeah, I would say that. Hmm, yeah, I'm just trying to think, I guess, a little bit more deeply on the biggest concept. Yeah, is just yeah, people think it's kind of one of those other things because there's not really anything else that they can like really associate it with.
Hmm.
Because I think it is its own thing, really. Like I could say,
Yeah.
yeah, like there's certain techniques that are similar to massage, but their intentions are different. And there might be some techniques that are similar to chiro, but again, our scope is broader, our intention is broader. Um, so I think there's like a lot of similarities of of how they blend, but we're just our own thing. Because I think just that softness um, is something, again, from my experience, is nothing else that I've ever seen. I don't see
Mhm.
that gentleness in, unless you're asking for it in a massage, which I usually do. I usually ask for the softest touch. But even then, sometimes that's not, it's not nearly as soft as it would be in an osteopathic session. So
Right.
so
Right.
I think that's the thing, is like it is its own thing. Um, but yeah, just to make it so it's not like, to get people kind of understanding it, it is a little bit a blend of all those three things. Like I think it's like the physio, where they're very in depth with their assessments. That's kind of where we're similar in. Obviously, with adjusting the spine, we're similar with the chiro. Obviously, we don't do manipulations with the actual cracking noise kind of thing. And then with massage, yeah, like we're working on soft tissue, but again, our touches is a lot different. And
Mhm.
I think how we work with, again, I'm not a massage therapist, so I don't really know exactly what your guys' intentions are. But I think our intention is on the fascial system. And again, maybe that is something that massage therapists are working on. Um, but yeah, that's kind of like what our intention is like we're working on fascia. Definitely muscles. We might be on a muscle, but our intention is the fascia encompassing that
Right.
muscle. Yeah.
Hmm.
Same thing
Hmm.
with if we're
That
working
makes
on
sense.
bones. Yeah. It's the
Yeah.
fascia around the bones. Yeah.
So you've got these kind of three modalities in which osteos kind of like it in various ways. But then one of the things I'm curious about is what's the other stuff? So I kind of see these like little techniques kind of that are not borrowed but similar to these other three modalities. But what
Hmm.
what makes it its own thing? Like what is the stand apart characteristic of osteo?
Yeah. Well, I think because we could say, oh, it's holistic, but I think, acupuncture is holistic too, right?
Hmm.
So I would say it's that in terms of like the things that we work on, like I don't know any other practitioner unless they're a specific visceral manipulation therapist. I don't know any other therapists that are going to be working on organs, right? Where they're
Hmm.
actually doing mobilization techniques on a kidney or whichever. So I think that is really the biggest thing, I think, because there are modalities like craniosacral therapy. Um, that is its own thing where you can be a craniosacral therapist. And I think it's probably a little bit more popular that there's craniosacral therapists than like visceral therapists. So that's where I'm kind of saying I think visceral manipulative therapy is kind of what osteopathy is kind of its thing, even though we kind of do all of them, right? We work on the joints, the muscles, the fluids, the craniosacral, the visceral, all those things we're kind of blending together. I think that's, I guess, what distinguishes us, is that we're blending all these different modalities to create, the best change for our clients.
I
And
take it.
yeah,
Can,
kind of like you were saying
can
before.
we talk? Sorry about
Oh
that. Yeah,
no,
carry
sorry.
on.
No, it's okay. I was
Yeah.
just quickly wanted to say just how it's like using the smallest amount of changes to make the biggest effect. So yeah.
Mm-hmm. I like that word holistic, right? It is a holistic medicine. Um, and what I'm curious about is
Mhm.
throughout the discussion, the the tissues that you described, it was all body, right? But when I think holistic, I think body, mind, soul. I think about this combination.
Yeah.
So within osteo, as a holistic medicine, what
Mhm.
aspects of mind and soul get brought into the picture?
Yeah. So I think of, well, we'll talk about the spirit and the soul here first, because I think it kind of blends into the mental a little bit. Yeah, when I think about the spiritual aspects of things, I think about just how in tuned they are with their own body. So there'll be times throughout a session where I'll be like, okay, I want you to breathe where my hands are right here. I might be on, an organ or a sphincter or just a muscle. Or I'll get them to, okay, I want you to push this direction right into my hand. So I'm getting them to coordinate with their own body a little bit. So I think there's a little bit of that kind of happening naturally as I'm going through assessments. But then also just like the very beginning process of the intake, right? Explaining that osteopathy is holistic, that we work on the mental, spiritual, physical aspects of health, that they all kind of help each other. And I think just even explaining that concept is in its own form a way of like being, oh, like I'm not just a body. I can help my body through other means. So I think just explaining that can be very helpful. And then as you go through the intake form, where we're kind of like talking about maybe traumas, maybe past injuries, relationships, stress, sleep, as we're just talking about all the aspects in their life, it kind of starts making them recognize things in their life that could be influencing their health. There's a lot of times where we're just like talking about things. We're like, oh, actually, I never thought about how much water I drink. I drink no water ever. And that's just an example, but yeah, I think that's just getting some recognition of like what's happening within their lives, taking a step back and being like looking at their life from an outside perspective. And I think it's looking outside not only from looking at their life, but looking at even just at their own thoughts, their own emotions, right? Being able to like take that step back and be like, okay, I have this feeling of anger or fear. That's an interesting feeling that I'm feeling right now, right? I may not understand why I'm feeling that right now, but it's just recognizing that you are there.
Mm.
And then I guess, yeah, in terms of this is kind of more of like the actual just discussion part, I think, in terms of the holistic and spiritual aspects. Um, but I think it's like just empowerment, even too, right? I'm wanting to empower them that, again, their body can recover, right? They're not broken. They have
Mm.
that ability to heal. So like even when I explain to all of my patients, my new patients, those principles of osteopathy. Um, and sometimes that's something that's a new concept for them. It's like, oh, my body self heals, like in every aspect, not just like little minor cuts and bruises, right? Everything. Um, but again, just there's varying levels of how much people can heal just because we've had so much individual stuff in our lives, even things from genetics, right, passed down
Mm.
from generations, right? So, um, there's a lot of things of improvement, but yeah, we do know there are limitations. It's not like osteopathy is the end all be all. Once you see an osteopathy, you're good, right? I think,
Mm.
yeah, allopathic medicine still very important, obviously. I think osteopathy is not going to be replacing that, but I think osteopathy should be a consideration for, supplementing with that because there's not any side effects really when it comes to osteopathic treatment opposed to taking medications. And again, I'm not against medications by any means, but definitely I feel like that is just the common thing to go for
Mm.
is just kind of, and I get it, right? If I want to get rid of my pain, if I take a pill, easy opposed to getting treatment done. But again, sometimes it's like that short-term fix versus that long-term solution.
Right. So when somebody comes to see you, what's like a timeline? I mean, I know that you can't be like it's exactly 6 weeks because every case is different. But like using the allopathic medicine, somebody goes to their family doctor. How many times are you going to see your doctor about that issue? Well, probably once to get your medication prescription, and then maybe to get it refilled.
Yep.
Somebody comes to see me as an acupuncturist, and it's rarely a one and done situation.
Yeah.
So what's it like with osteo?
Yeah, I think it can be similar. There's times where if someone's been having stuff going on for 20, 30, 40 plus years, in my mind, I'm already kind of like, okay, I'm not expecting to fix it all today. You know, Ideally, yeah, that'd be great. But yeah, there are times where people come in with headaches or migraines or something, and it gets significantly better after one session, and then I'm like, awesome, right? So I think, yeah, very much can vary. I think I think the effectiveness of osteopathy. I think when people have a lot of pain already, or they have a lot of like stress going into it, I think that does just almost limits, I guess, the number of things that we can do to help someone because um, yeah, there's a lot of techniques that we do that take energy out of people, and if they already have like no energy to begin with, then it just kind of narrows down a little bit of some of the stuff that we're going to be doing. So ideally, we want to get them to the point where they can have a little bit more freedom of movement, or they have not as much stuff going on. But again, it's not that we turn people away. It's just like I just noticed that I would love to do more with them, give them more treatment, but that's not what their body needs. So, and that's the thing is like people want, give me all the treatment, I can handle it, I swear. I'm just like, I get you. You want to feel better, but we have to do it on your body's time, not on your time.
Hmm.
So that's, I guess, yeah. Unfortunately, it is a little bit of a go around where, yeah, it's not necessarily a set straight cut and dry, but I think a lot of it is around just like longevity of how long an issue has been. But I've definitely had cases where people have had it for a long time, and then it gets really big improvements after only a few sessions, and then the opposite happened where it's like, okay, there's no improvement or very minimal improvement. Um, so yeah, unfortunately, it does kind of vary a little bit.
Hmm.
But yeah, I would say people generally do feel noticeable results after a couple of sessions. And I know for myself, if I'm working with someone and they're not really getting much results after a few sessions, right? I'm referring to other people. I'm also just, I'm trying to tell them, like, hey, there's so much stuff for us to uncover, right? It does take time for us to kind of look through all these things. And I know for myself, I try to improve, so I'm not spending as much time trying to figure out what's going on. But yeah, just part of the practice. Um,
Hmm. Hmm.
yeah.
It makes me curious about the common challenges. Like, are there things that come up regularly for you as an osteo where you're like, oh man, this is challenging, this is hard,
Mm,
or you specifically individually within your practice? So what are like the big challenges that you encounter in your practice?
yeah, some of the challenges. Um, I think some of the challenges would be, well, I think the biggest challenge is no one knows what osteopathy is. So I think the expectation of what am I going to expect? Some people have like no expectations. Generally, people don't because they're like, it's something I don't know a whole lot, so I'm not expecting anything. But some people have this expectation of like, I'm going to be healed, I'm going to be 100% better. So I think that's one of the challenges is just kind of going off the start and being like, hey, this is, trying to lay down some expectations, right? Ideally, yeah, they're better after one session, but there's never any guarantees for that. But
Right.
generally, it's like I'm putting pieces of the puzzle back together. So how much improvement, varies. But I think overall, I think there is some improvement always after a session, whether it's felt right away or later on. I think that's just what depends.
So no one knowing what osteo is, it definitely sounds like a challenge for many reasons. But one of the things that came up for me is, how do you get clients? Like, if there's this, like, you hand out a card and it's like, I'm an osteo, people are like, cool.
but
Like, how?
yeah, totally, yeah, yeah.
So what's that process like?
hmm Yeah, I think a lot of it is just like you're working with other health practitioners, other people that like are known, like physios, chiros, massage people, um, yeah, or other just health related people. Like, a lot of my clients were initially just training clients, people who were just wanted to take care of their health and wanted to be, independent and have long, happy lives. Um, so yeah, it's really just you find those people that are either really struggling with something physically, mentally. Um, yeah, because they're generally like they've tried all the things. Usually, is what I find. It's like they've tried massage, they tried chiro, they tried, and again, maybe they tried it once. So it's like I'm not gonna be like, oh, you tried it once, oh, it probably won't work for you ever again. Like, um, yeah, there's definitely other practitioners that might still be able to help there. Um, but yeah, it's just kind of like you find people who just like are struggling to find results, trying to struggle to find resolve to their issues. So it's kind of, I guess that in that sense, it is nice, and I feel very privileged to help people who are really just trying to find a solution. And I know for myself, I've been there. I've been there where I've struggled with pain, and where like like you were mentioning, like doing literally all the modalities. I'll do anything, I'll do everything to try and resolve it. Um, so I think, yeah, in terms of finding those clients, it's just like just trying to get other practitioners to feel a session. Like I work with a lot of them, and I just say like, hey, if you haven't had one, I'll just give you one because I want you to understand what it feels like to go through a session. So sometimes it's just you get a better understanding after feeling a session than an explanation. um,
Hmm.
but yeah, throughout the whole process of a treatment, I'm also explaining what I'm doing too. So I think that helps them understand as well, because there's a lot of things where I could just say nothing the whole time, and they would have no clue. They would have no idea what I'm doing, and they'd probably be like, yeah. And that's where we get this thing of like, oh, you're magicians, you're wizards, because I don't know what you did, but you helped me, right? And I think all that's it sounds nice, but it's like I think I want to get away from us being these magicians to more of like, okay, we're these actual science, anatomy based, practitioners that are helping through just our understanding of how the body works.
Mhm.
Um, yeah, yeah.
I
So
certainly appreciate that aspect of it. Is excuse me, that osteo seems to be doing its very best to be founded in science, and yet still keeping space open for those other two pillars of integrative medicine, being the mind and the soul. I really appreciate that about osteo, and one of the reasons I'm grateful for this conversation is my experience with osteopathy is universally good.
mm,
Be it a just simply relaxation, just this feels good and I'm enjoying the process, or this is profoundly effective. So I'm really grateful that the education aspect is a major part of this conversation. And
yeah.
within that, there's one curiosity that came up through our conversation. I'd like to loop back to visceral manipulation.
Mhm.
And I'm very curious about it because in acupuncture and Chinese medicine, it's all about the organs, right? Like one of the main lenses in which we look at the body is understanding characteristics of organs. And when we learn about organs, we learn about them in multiple different ways, but one of the simplest ways I describe how we view organs in Chinese medicine is you kind of view them as characters. They've got their own personalities, their own energetic and spiritual functions. Yes, the liver does the thing that the liver does physiologically. That is certainly a thing. But
Yeah.
also, the liver is the organ that's associated with anger. The liver is the organ that's associated with dreams, with growth. The liver moves chi. It's got all of these other functions.
Mhm.
So when you view organs within osteopathy, are you just like massaging the liver because you think the liver needs to do one of its 360 functions? Or is there something else going on with visceral manipulation that's more akin to
Yeah.
what we do in TCM?
Hmm. Yeah. So like I guess whenever I'm thinking about working on an organ, like again, I'm using my palpation skills. I'm using my listening skills because in terms of like what pulls me to like, okay, I'm treating the liver here. It's based on just like the basically I guess the little lesions, I guess, is kind of what my main understanding is that whether it's like this lesion is developed through its lack of functioning or a lack of fluids going to that organ, or maybe there's a structure associated around that liver that's affecting its movement or affecting fluid flow. But essentially, yeah, it's like I'm palpating and I literally feel my hand being pulled towards the liver. Right. So I do like a general listening technique where I'm putting pressure on the top of their head and their body will tip in a certain direction. And it's actually very cool. It's something I show people a lot where I'll do it on them, right? And they'll tip a certain direction, right? I'll literally just like poke the spot that I think is causing this issue, and their body will just naturally come back to center. It's one of the coolest things actually. And it's like I get people to do that same thing where it's like they got a tight shoulder and like, okay, touch the organ. Oh, whoa, look at all the range of motion we have now. And it's just like, that's just to me, this is so cool. But then, yeah, but then we go a little more specific where we actually lay them on the table. I'll start above their pubic bone, just kind of start where the bladder is. Sometimes I'll start from the feet because that palpation and listening skill doesn't apply just to organs, it's to muscles and to everything. So I'll go from the feet, work my way up, and then, okay, now I'm kind of in the main area of the organs. Now, which way do I get pulled? But it's funny because you'll get pulled in a bunch of different areas. You'll get pulled over here, and you have to do what we call an inhibition technique where you're turning off the organ, kind of like I touch the organ. It kind of, for some reason, functions or turns off that pull towards the body. And so you do that a couple of different times where I'll actually have to use my patient's hands because I got like maybe 3 or 4 organs that I'm getting pulled to. So I'm literally using their hands. All right, your hand's gonna go here on the sigmoid colon. I'm gonna put your hand on the stomach here. And then eventually we start prioritizing what is the main one. So once if I let's say have 3 different organs, all right, I'll feel on let's say the liver here. I'm feeling down here by let's say the sigmoid colon. And I'm feeling both, and one of my hands is actually just going to feel like it gets pushed off. It feels weird. It literally feels like it's being pushed off. So if my hand gets pushed off the sigmoid, I know the liver is the main issue there. It's getting pulled into the liver. So that's kind of
Mhm.
like how I go about figuring out which organ is kind of going at that. And again, there's a little bit of that intake too, where it's like, oh yeah, they have, pain in their shoulder, right? Or they have, yeah, all the kind of associations with this dysfunctional liver. That's okay. Yeah, I'm gonna be thinking about that. But I kind of already talked about a little bit how sometimes they say all these things that sound perfect for like liver dysfunction, but then we do that visceral listen. It's actually, oh no, we're getting pulled now into their kidney, which
Mhm.
has a strong relationship with the liver, but may not actually be caused by the liver. So
Right, right.
yeah,
So
so a
pattern
lot.
recognition.
Yeah, so it is a little bit of like you're taking in that consideration where you're okay, like that's kind of where I think I would get drawn to, but then you trust your palpation and you go with what you feel.
Cool. That's really cool. I find the visceral aspect of osteo to be very fascinating. So I'm grateful for the explanation.
It's awesome. Like I think I was a little hesitant to do a lot of visceral off the beginning because it's so like, oh, you're like playing with people's organs, and like, they're not like they're frail. They're not like you can just like jostle them around. So I was always like, oh, I don't want to mess people's organs. But I started realizing that, because it's so gentle, you're not really ever worried about that. And the amount of change you can see in people in terms of like structural change, where I don't necessarily have to adjust people's spine as much because it's like, oh, it's actually the organ, and it's actually a lot nicer of a treatment to get visceral than let's say a spinal adjustment. Not to say like it's uncomfortable, but just in terms of like how it feels, it's a little bit nicer of a feeling to get a visceral treatment than a
Mhm.
spinal adjustment too. But yeah, no, it's kind of nice to work that way. Plus, it's you know you're generally laying down doing a lot of visceral treatment. There are some that are a little more seated or standing, but yeah, it generally just keeps the client a lot more relaxed, and that's kind of my whole goal is like I want you in pure bliss through the whole treatment, where it's like you're just in like on cloud nine, just relaxing, having a good time. So that's kind of like what I'm keeping in mind too. It's like as much as I may need you to roll over, move around, I want to try to keep you comfortable and keep the session smooth as possible.
So you have this background as an athlete. You're growing up very physically active, into sports, hockey. You get into personal training. Um, as a TCMD, I view most things through the lens of yin and yang. That's very yang. It's very energetic, right? It's very mm.
Yes.
And then there's osteo, and everything I've heard you talk about osteo, it sounds very yin. It sounds very gentle, slower pace, right? So I'm curious about that process for you as an individual. Like what was that like in your own personal growth, your own spiritual development? Any way that we can describe that as you shifted from this more young world of do and action and more masculine, I guess you could say, to more of this gentle. How is that? What happened in your own inner experience as you spent more of your life in this yin gentle world?
Yeah. Oh man. I think it was that shift of like focusing more on my spiritual health, I would say. Because I was like so like I was like, oh, everything gym, just that's fitness, everything's gonna get better if I just get fitter. And I think that was what really shifted like recognizing that the spiritual and mental health are just like those are factors that are going to affect your physical body. And so I was like, oh yeah, I don't really spend a whole lot of time focusing on improving those aspects as much. um, so I think that was the big shift, just like looking at like defining my purpose, defining my meaning in life. And it's funny because as soon as I started recognizing those things, that improved my mental health too. Just like feeling so much better. Yeah, so I would say that was the biggest thing, was just shifting from just everything from just like, you know, and yeah, I guess I talk about physical, just like the gym, but it's even like, yeah, nutrition, lifestyle, sleep, those sort of things. But I think the things that really shifted was just, yeah, I was focusing on just, I think that mindfulness. Yeah, being
Mm,
like in tune with like how not so much the feeling, because I've always felt like I was fairly in tune with like, oh yeah, I feel the burn in my muscles or I feel the pain in a certain spot. I was always fairly in tune with that, but it was more of like on the emotional and like the thought side of things. Um, yeah, just like struggling with just like, oh, like I have this emotion. I have no idea what to do with it though. Um, but yeah, I think now it's like, okay, yeah, I have these emotions and I just recognize it. I just recognize it for what it is. It's not who I am. It's just like, huh, I got upset at this thing. Okay, that's interesting, right? So I think just
Hmm.
a lot of those things don't affect me as much where I'm like, oh, like these emotions control me so much. I think it's now just like I feel a lot more, I want to say zen, but I don't like to say zen. I like to say just like peace. I feel a lot more at peace when
Yeah.
right now. Whereas before I was always like, oh, I need to like just like constantly just improving my health. But now it's like I feel just more, yeah, more into that spiritual side of things. And definitely I've delved into my own religious experience. I'm a Christian, so that in itself is helped my spiritual health substantially, and I think in turn it's improved my physical and mental health as well. So yeah, I don't necessarily think necessarily everyone has to go to church or go to religion, even though I would say that would probably be helpful. But yeah, no, I think
Mm.
definitely it's just recognizing that that is an important part of what impacts our life. I think just the main thing is just recognition. It needs to be
Yeah.
recognized and seen as important.
I dig that. I like that a lot, and that's certainly something I've come to appreciate more through this conversation about osteo. It seems as though the process of just simply being in that world requires a higher degree of balance between these different aspects of self.
Mhm.
And I'd like to ask you one more question as our time comes to an end here. And it's the
Sure.
same question that I ask every single person on the podcast.
Okay.
And it's in your experience, both as a practitioner and somebody who's received treatment, what do you think makes a successful practitioner?
Oh, that's great. Um, I guess that definition of success is different from practitioner to practitioner because I think they what their goal is going to be different. But I think for myself, I think success is well, I think for it's people knowing that you are the person to go to. You're the go-to person that if they have an issue or a problem, they're going to go to you. And whether or not I'm the person that actually does it or I can delegate it to someone else, I think that's the thing. It's like, I, I think just being that person where it's like, oh, like I having this problem. Oh, I know Ryan can actually help me with this. I think that for me would be success is where I have, that strong community of friends and family that can rely on me for that. I think that would be my definition of success. Um, and then for I guess you can go further of like, yeah, like it's nice to make money doing this too. But for me, like if I'm helping people, that's really essentially the big thing. Like I'm gonna get rewarded through that, and just by doing a good job. And people can generally feel that the genuinity of like how you really want to help people. It's not just like you're not just a number. You're not just like, all right, you're not just like paying for my bills. It's like I genuinely care for your well-being.
Hmm. I like that. Thank you very much. And is there anything else that you'd like to add that we didn't cover that you'd like to dig a little deeper into?
Um, yeah, like I think if we come back, just guess a little bit in terms of like that, distinguishing thing from osteo and other practitioners. I think the main thing I tell people is that we work with fascia. We work with fascia, and fascia and fluids are kind of very similar because they're, if you ever look at fascia from a microscope, it's like this liquid string.
Hmm.
So I think that's when I think of people and I'm telling them like what we work with fascia. And I know that fascia term is like, oh yeah, fascia, sure. But how important is fascia? Because fascia used to be tossed out a long time ago, but we're starting to recognize how important it is because it connects everything together. And there's a lot
Hmm.
more fascia in the body than really is a lot of other stuff. So I think that's in terms of like the area that we kind of dive in. It's fascia and fluids, and one of the main principles of osteopathy is that the rule of artery is supreme. So our blood flow fluids need to get to where they need to go and they need to be able to come back, and that's in a similar way with acupuncture where you're working with stagnation, right? right? You want to keep fluids cycling.
Mhm.
And I think that's kind of the same thing for us. We're recognizing the travel, the pathway of where fluids go. So we kind of know if, oh, you got elbow or, hand pain, right? And it's like, okay, well, everything looks good here, right? We're going to be looking at subclavius. We're going to be looking at that pathway and seeing, are these things impinging there? So just kind of, yeah, I just want to touch on that because I can't remember if I touched on that for some of the principles of osteopathy. But yeah, I think that's an important thing to touch on is just that we're fascia experts, and that's kind of our realm. And when you know fascia, you realize how encompassing fascia is and everywhere in the body. Yeah.
I 100% agree. 100% agree with that, and I love it. So, thank you very much for your time. This was a very informative and enjoyable conversation, and thanks
Yeah.
again.
Thank you, Jess. Yeah, I just
Mhm.
want to thank you for doing this podcast. I think we need more people like you, and I just want that's why I wanted to get on this because I think what you're doing is amazing, and I think we need more people like you out there, and that's where I'm going to be promoting the heck out of you, and I just want to thank you again for carving some time out for me and giving me the chance to explain what osteopathy is. So thank you.
Great. My pleasure.